I think one of the things I do want to emphasize is the concept of metabolic surgery. We've talked about weight loss surgery, and the weight, yes, that's a number. It has a numerical value. You can follow that and track the person as they progress, but we're really focused on the metabolism. So, for instance, patients who have diabetes, patients who have heart disease. If you look at the condition of type 2 diabetes, the vast majority of patients, over 70% of patients who have type 2 diabetes will die from a complication of the diabetes. And at any point in time, patients with diabetes, despite medical therapies that they're on and the various sophisticated new drugs, at any point in time, a majority of them, over 50%, are not under good control, good glucose control. So we have something that we can offer patients that will immediately start having an impact. We don't like to say it cures diabetes, but it immediately starts having an impact on glucose control and can actually lead to getting people off medications within a few weeks and certainly within a few months. Getting them off insulin, getting them off the oral medications, and getting control of their sugars and stopping that progression of the disease that starts to have damage to the various organs, whether it's the kidney, whether it's the heart. So that concept of metabolic surgery is one that's very important. There are other conditions aside from diabetes that are related to increased risk of death and that are related to obesity, particularly sleep apnea. There are many people who suffer from sleep apnea because of obesity, and these people end up having apneic spells. They stop breathing sometimes more than 50 times an hour. Some people stop at a stoplight and fall asleep, and only when people are honking that they realize that they were actually sleeping. So sleep apnea is a serious thing and can lead to death. During an apneic episode, it may trigger an arrhythmia, an abnormal beat in the heart, and so often we hear of young people dying in their sleep. That often is related to sleep apnea. The problem of hypertension. People have referred to hypertension as the silent killer. Getting the weight down, having surgery that will have an impact on that condition is also very important.